Let's talk. Hi, and welcome back to Pocket with Pediatrics. I'm Dr. Richland Brown, and as usual, I'm always so happy to have you here with me today. And last time we spoke not just about the newborns, but the just borns, because we spoke about what to expect in the first 2 days of life. Today, we want to talk a little bit about what to expect at that first well visit outside of hospital, and that's the 6-day visit. So, let's talk a little bit about what to expect at this wellness check. Now, I should have said before that in the first 2 days of life, baby would have gotten vaccines in hospital. And that would have been the hepatitis B vaccine. And here in Jamaica, you get the BCG vaccine, which helps to protect you against tuberculosis. So it depends on where you are, there are different standards, right? That this 6-day visit, there are no vaccines. It really is just a wellness check for mommy and baby to make sure things are going well. Everybody is adapting well to this new relationship that you both have. And mommy is doing well in terms of getting some rest and nutrition as well. And we'll also speak about how mommy's milk supply is going. Because if mommy is not well hydrated or well nourished or well rested, all of those things are going to affect her milk supply, which also affects baby. And baby can also, sense when things aren't going so well. So we want to make sure we have a well mommy. But with respect to baby, we're going to be looking at things like baby's nutrition, baby's weight, baby's diapers, how many wet and dirty diapers they're passing, their umbilical cord, how that is doing. And of course, there are some developmental things that are able to be seen in this very newborn period. And of course, we also talk about the jaundice that we spoke about at the end of the last video as well. So let's talk a little bit about each of them. So with respect to nutrition, we want to make sure that your breasts are feeling full, that you're having that feeling of sensation when baby sucks, and you may have what we call contralateral leak, meaning that if baby is sucking on the right, then the left side may leak a little bit. Can be a little bit embarrassing, but it is something that we expect, and it's good because it tells us that you are making a good milk supply that should be meeting baby's demands. And now for baby, we wanted to know that baby now has learned how to get that latch and put that mouth around the areola, that's the dark part of your nipple, or the dark part around your nipple, and that they're able to really express and get that milk from milk glands, because that's where they are, in the areola, not on your nipple. So it shouldn't be painful if they're latched on well. All right. We also want to see that baby is passing enough wet diapers and passing stool. That too tells us that baby is getting good nutrition and getting enough hydration. So with respect to the stool, remember we said that we should be getting 4 to 6 dirty diapers per day. And that sticky meconium should have passed now when you're getting that more what you expect for stool color, which may be yellowish, like a mustard yellow, maybe a little greenish, a little brownish. What we don't expect is that there's any blood, right? So if you're seeing that, that's something to bring to the attention of your pediatrician at this visit as well. Now, as I say that we expect 4 to 6 dirty diapers for the day, there are also babies who may pass stool with every feed, and that may be 8 to 12 feeds per day, depending on how frequently your baby demands. Or they may not pass stool for up to 10 days, and we don't find that to be abnormal either or consider that to be constipation. But we must make sure that baby is not vomiting, baby is not having any puffy belly, red belly, any stiffness of the belly, none of those things, not excessively fussy. All of those things need to be absent for us to be okay with baby not having stool for several days. And there are things that you can do as well to help the stool to come, like massage the tummy or cycle the legs. So those things will help. But don't be too concerned if baby's a little squirmy, or you might hear a few sounds as they're trying to pass stool, because they're learning to coordinate things to get it all out. So, you know, just be patient with them. But if you do have concern, bring it to attention of the pediatrician as well, and they'll be able to check to make sure baby's tummy is okay. For the wet diapers, we do expect 6 to 8 wet diapers per day, and that tells us that yes, baby is well hydrated. Another thing that tells us about nutrition is baby's weight. Now, in the first week of life, your baby is going to lose some weight. We do expect that. And that's because when they come out, they have a lot of fluid on board from inside the tummy, and that's going to evaporate, and that causes some weight loss. But we expect that if baby is being fed well, that they should regain their birth weight by the end of the first week of life. Now, as I say that and all the things I said about stool and latching on and so on, remember I always like to say you must be prepared that if doctor is not happy with what's happening, that there may be need for admission to hospital. So I always say keep a little bag in your car and keep in your mind that that's a possibility. And also with respect to feeding, that remember a well-fed baby is better than a breastfed baby. So if there are difficulties with the latch, or just getting that milk supply established, or we may need a lactation consultant, remember that a bottle-fed baby is better than a baby who's not fed at all. Okay, there's time to get that breast milk established. Remember that we encourage breastfeeding for the first 2 years of life. So if it's a little shaky in these first couple weeks, no worries. There's time for baby to get that breast milk, but we want baby to be well hydrated. So supplement if you need to supplement until breast milk is fully established. Now, the other thing that we look at is the umbilical cord. We do expect that it will begin to dry up and fall off within the first week or two of life. What we don't expect is that there's any excessive wetness or blood or pus coming from the umbilical stump. And again, if that's happening and there's any funny smell, again, that may be a reason for doctor to send baby to hospital. So we just want to be sure that all things are going well. But most babies don't have those issues with their stump. Now, development. Development, I think, is quite fun for parents to see what baby can do. So, doctor will test a lot of their primitive reflexes to make sure that they are doing the things that they should, which include letting the baby's head fall back a little bit and they'll look like they're a little startled, putting baby's feet on the bed, and you'll see them making stepping motions, and baby will even do a little dance when we stroke their backs from side to side, and that's all normal. Those are things that they will lose over time as they get a little bit older, but we want to see them now in the first months of life. Now, jaundice as well has to be spoken about. And again, if baby had jaundice before they left hospital, now is the time for us to be making sure that baby is visibly, looking less yellow than they were looking in hospital. Or if repeat blood tests are necessary, that they're done here as well. Sometimes jaundice may take up to 14 days to really resolve, but if it goes on beyond that time, further evaluations will need to be done. So if we're noticing that it is getting up to that time, we may have to bring you back for a review earlier than we would normally have brought you back. And as we say that, when is the next well visit? Because those are the things that we're really looking at in this first 6-day review. So the next visit after this is going to be at 6 weeks if you live in Jamaica and other areas of the Caribbean, or 2 months if you live in other territories. And what are we concerned for here? What is going to happen between now and then? That's a good question. So that's what we're concerned with next. So after we've assessed mommy and assessed baby and everything is fine, the next thing to ask is, do you have any concerns? And now is the time to bring up all of the things that you need to ask doctor so that we can allay any fears. Because sometimes the things that you're concerned about really are normal and really just want to put you at ease. And then the other thing is to provide the anticipatory guidance. So the what to expect between now and next time that we see you. And this anticipatory guidance is going to talk about what things will happen in their development. So remember, we spoke about the 4 areas of development: their gross motor, their fine motor, their social, and their language. So I can put a link to that video for you down at the bottom. And we also talk about things that will help you with safety or just general care of the baby. So between now and your 6 week visit, we're going to expect that baby is going to be able to hold up their head when you put them on the tummy. And some babies may even be resting up on their arms a little bit. We also expect that baby is not going to be as curled up as they were before, but they start to get a little bit looser, opening the hands a bit, and they're moving those arms and legs. For their fine motor skills, before in this newborn period, really all they can see is from the crook of your arm to your face, but their vision is going to get so much better, and they're now going to be able to see you across the room, and you become their favorite thing to look at. So they will watch you as you're doing different things and activities across the room. For their language, they're going to startle. So we do expect from birth that loud sounds will make baby react. So if they're not reacting, bring them to doctor and make sure that we assess to make sure the hearing is fine. But we also expect a little conversation to start. So baby's going to start to coo and make those baby sounds that make you know they're interacting with you. And the other part of interaction is their social development. They're going to start to smile. And they're going to smile not just like a random smile that you caught on tape. They're going to start to smile because you are smiling at them. And they're noticeably happy when you start to come toward them. And they also learn how to calm down and quieten down when you talk to them as well. So their social skills are developing. With respect to safety and other things that we need you to know, remember we're going to talk about the need for a car seat. So if you're traveling in a vehicle, they do need to be placed in a car seat, and this car seat needs to be rear facing in these first few months of life. So follow those instructions very carefully for how to install and place your baby in your car seat. We don't want you to leave your baby in the car seat when they come out of the vehicle because they're napping. That's not safe for them. It can and has led to death in some babies. So once you get baby out of the car, take them out of the car seat and put them down. And as we talk about putting them down, sleep. Sleep is a very important one. Now, what do we need to know about sleep? Babies must always be put back to sleep, right? So they're put on their backs to sleep. And that's because any other position has been associated with an increase in sudden infant death syndrome. And we don't want that for you or your baby. We do encourage that in the first 6 months of life, baby rooms in with you, but does not co-sleep with you. Rooms in with you means baby is sleeping in the same room with you, but in their own crib or their own bassinet. Co-sleeping is not advised, and that is baby sleeping in the same bed with you, because that has been associated with an increased risk of strangulation or suffocation of baby. And again, we don't want that for you at all. We don't want any tragedies. So babies to have their own crib or bassinet in your room. And also, we want baby to learn to soothe themselves, because you want them to be able to put themselves back to sleep, right? And for you to be able to get enough sleep as well. So one thing we encourage is not to allow baby to fall asleep on the breast or with a bottle in the mouth. But when they're about 80% sleepy, that's the time to put them down in the crib. Because though they may fuss up and kick up a little bit, they should be sleepy enough that they will quickly fall off to sleep. And then they'll learn that when they wake up, and if they're not wet, they're not hungry, they're able to put themselves back to sleep. And that means good rest for you and good rest for baby. Because remember, you need to be well for baby to be well. And lastly, we need to talk about signs of illness. So, when do you come to seek attention? Because we're not going to see you for a good couple of weeks, right? So, we talk about if baby has fever, but with fever, we have to be very careful because babies really can't manage their temperatures well. So, they may get too cold or they may get too hot. So to be sure that a baby has a fever, especially if they're bundled up in they're swaddled up in their blankets, you want to make sure that you unswaddle them and leave them to be at room temperature for some time. And then you take the temperature to see if they truly have a fever. Also have a video on fever. So you can know what is a fever, where to take the temperature, how to use a thermometer, how to read it, okay? That's all important because any baby of this age who's less than 6 weeks old, who's having a fever, really does need to see the doctor. It's not something to just give them medication out. They need to see doctor to make sure all things are well. And we talk about as well if they're very lethargic, so hard to wake up, they're not feeding well, or they're very, very fussy, especially more fussy if you're handling them. Those are all reasons to come and see a doctor. And remember, be prepared for possible admission to hospital, especially when they're so young. Sometimes they really do need admission to hospital to evaluate what's really going on. So that's it for Pocketbook Pediatrics today. As usual, we really thank you for sticking with us. And, congratulations to you again. And I hope that you continue to grow and grow and grow and continue to adjust to this period, you and baby, and keep yourself well. Because if you're not well, baby is not well. So thank you so much for watching, and we look forward to seeing you the next time on Pocketbook Pediatrics. God bless.